So there's definitely demand for healthcare professionals who have management skills. I'm sure Professor Bhatia would agree that,
Yes.
like any other industry, healthcare industry also has a great scope and need for managers and leaders who have specific skill sets, which we are not trained in medical schools or nursing schools, but we end up managing a lot of things in the hospitals and health clinics. So there is a great demand for them. So Professor Bhatia, the slide that I've put up is just different kinds of functions that can work together in a healthcare setup. But my point is not to talk about each one of them, but to say that there is need for management. Professor Bhatia, today healthcare has so many different functions that need to harmoniously function together. And every individual leader or manager or any individual who's working in those departments needs to understand that coordination as well. So, which obviously requires a lot of management skills and administrative skills. So, anything at this point, if you would want to add or comment?
Yes, definitely, Dr. Shravani. From the slide, we can see that not only in hospitals, but healthcare professionals are required in so many different areas. And like you showed in the previous slide, even home care and so many
Yeah,
new startups and digital health. A lot of
yeah,
young people are coming into that. And with the technological changes, one also has to develop the managerial skills and time planning and also strong communication skills, which are also taught in the MBA. And besides that, the main thing is to how to develop leadership skills and have motivation to not only lead oneself and be and galvanize oneself every morning, but also lead the team forward, because each day is a challenge today, and the
yeah,
competition is so razor sharp.
yeah.
So
Yeah, Professor Bhatia, while I give you all the freedom to talk about this one slide because I want you to spend enough time on it, I just want to add something before you go on as a seed. A lot of the times, what happens is, being a medical doctor myself, I understand this. For every profession, every department or function that you get into a role, there is a specific training or qualification or a program that you take, go through, get qualified, and then get into that role. So I've been trained as an MBBS graduate and then a postgraduate, so I get into a clinic or a healthcare sector. But a lot of the times, the unfortunate situation, I would say unfortunate for the reasons that we see the shortcomings in the practicality. The unfortunate situation is that a lot of us, either doctors or other healthcare professionals, we end up getting into these management roles without being formally trained in any way. All that you've put up on the slide is not taught in a medical school, and a lot of the audience today may not agree that we need to learn these to get into a management role. So I would like you to talk about these points and please connect them to why and how they would add value to anybody as a healthcare professional to be a manager.
yes, thank you for giving me this opportunity, and I'd definitely like to tell the audience that management skills are not only essential; are absolutely needed for progress in life, and it's to plan one's work better, and also for that one needs a lot of quality thinking, and problems are arising every day. So the teaching pedagogy here is of audiovisual lectures and followed by case method assessment. So after each block, we have a case study followed by multiple choice questions, and this assesses the students' progress from the first block of the syllabi to the fifth. And for example, we have introduction to hospital and healthcare. So there would be 5 blocks, and the first block would be the introduction. And here they would see the audiovisual. There would be some study material, and they would have to go through each audiovisual and also the case study before they move on. So
Right.
they are checking their progress, and they can also go back if some people are working. They can go back to work and try the analytical skills that they are learning online. Another important thing is that students of online uh, can use this at any point of time. It's a 24/7 study.
Access.
Yes, access. And if there's any query, we try to solve it within a few hours. And we also have live sessions. So,
Yeah.
so it's not only just a viewing session, but also an analytical, conceptualization, and practical area where managerial skills are required. And today, each skill requires a lot of effort and practice, and that is what we try to give in our courses.
Right.
So, besides that, we teach the rudiments of management in the first 2 years, and then go ahead with the specializations. And we also have a
Right.
project and dissertation and an internship. So a combination of this gives a complete uh, course and a complete program to the participants and to the learners, where they can also have extremely strong knowledge in hospital and healthcare, because those are specialization courses. But we also have introductory courses in the first 2 years, where the rudiments of all the domains are taught. For example, business communication, economics,
Right.
quantitative techniques, and uh, finance, human resources. And
Yeah.
so these are absolutely important in the process of growth and solving one's challenges quickly. Because as you know, today time is very, very precious, and our response rate has to be very quick. So the course can actually develop one's skill to think faster, get the right answers, also analyze properly, and get a solution, because everybody is looking for solutions at work. So this is the course that looks at not only communication, uh, more motivation, planning, and how to deal with the team, and coordinating, and also a very strong element of management, which is a well-rounded curriculum for the learners, so that they can actually go ahead and move faster in their career.
And of course, the contact session, this is for the audience info. We have a contact session of during the third semester as part of this program, wherein the students get posted in our accredited hospitals, wherein they spend time in different departments, crucial departments, and understand how each department coordinates with one another and what runs in each department. There are a lot of things that you see from outside, but there's a lot goes on from back end. To go there and see and learn. One important point you've mentioned, Professor Bhatia, is finance and accounting. Of course, as women, we're all bad in accounting anyway. But even I've seen a lot of my male colleagues and friends who are not at all good with the terms like valuation and understanding the revenues and break even don't make sense. But having those basics in place will help us get to that next level in whatever role that we're playing. So I'm sure this program with that contact program attached will add great value to people who want to become leaders, as a part of an institute that you're already part of, or like Dr. Avnish mentioned, if you're trying to do your own thing also. Healthcare entrepreneurship definitely needs a lot of leadership skills and management skills. So yeah, so that can definitely add value. Professor Bhatia, going forward, before I go on to the key players in the market, because we are discussing about what are the key skills and why these skills are necessary, now that we've put forth the program in front of this audience,